So, a very good evening to all of you. Today we are going to discuss a very important topic, that is approach to breast lump. So, in today's video we are going to discuss about how to approach a patient with breast lump in OPD or IPD on the basis of history and examination. So, this video is very important to diagnose or to come to a diagnosis in case of a breast lump. So let's start. First of all, there is breast lump. Now we are going to discuss about the approach. So a patient can present with a breast lump which can has pain or it can be painless. So we are going to divide the breast lump in two major categories: if the patient has pain or the patient has no pain. So first of all, we are going to discuss about the painless breast lump, that is non-inflammatory swellings. And after that, we are going to discuss about the breast lump with pain, that is inflammatory swelling. So if any lady present with a breast lump which has no pain, then the differential diagnosis for that lump are fibroadenoma, ductal papilloma, phyllodes tumor, hamartoma, galactocele, breast cyst, hematoma or fat necrosis. So these are the differential diagnoses for painless breast lump. And for the painful breast lump, it can be a breast abscess or fibroadenosis or periductal mastitis. So these are the two main headings for a breast lump. Now, after asking about the pain or painless, now we are going to approach each differential diagnosis in detail with the relevant history and examination. So first of all, we are going to discuss about the painless lumps. In painless lump, the other differential diagnosis can be a malignant breast lump, which involves the two differential diagnoses: invasive ductal carcinoma in situ or malignant phyllodes. So these are the list of all the painless breast lump, including the malignant one. So now we are going to discuss each painless lump with its history and relevant examination point. So first of all, if a patient of age group 15 to 30-year-old female present with painless breast lump which is slowly in progression, means there can be history of years like 2 to 3 years, and the swelling is slowly increasing in size. So first of all, the patient will be of 15 to 30 year and the lump will be painless and slowly progressive, and on examination the breast lump is non-tender, means there is no pain on palpation, and the temperature of the swelling within normal limit, and the swelling is free from the skin and the subcutaneous tissue, and there is no involvement of axillary lymph node. So the differential diagnosis for this patient will be fibroadenoma. The key point is here painless and mobile. Mobile means no fixity to skin and no fixity to subcutaneous tissue. That's why it is known as breast mouse. So this is the history and the examination findings for the fibroadenoma. So this is the first case in OPD of painless breast lump. Now, so after the fibroadenoma, we are going to discuss about the second case, which is a lactating female post-term, just delivered the baby and due to any reason unable to feed the baby, unable to feed the baby and like unable to evacuate the milk from the breast. Then there can be a well circumscribed mass behind the nipple and there is presence of milky discharge. So this is the key point, there is a presence of milky discharge from the nipple on palpation. Then in this case the differential diagnosis will be a galactocele. So a lactating female in gynae ward unable to evacuate milk from the breast or unable to feed the baby due to any reason with a well-defined mass in the breast, and on the palpation you find the milky discharge from the nipple, then you will suspect a galactocele. So this is the second case in list of painless breast lump. Moving to the third, a patient present in OPD with a history of trauma to breast or history of subcutaneous injection to that breast, and the lump is painless, non-tender, but the consistency varies here. The consistency of lump will be hard, but in fibroadenoma it will be firm. So the consistency is hard with history of trauma, and the margins of swelling are irregular, and it is fixed to the skin. Here it is fixed to skin, but the fibroadenoma is free from the skin and the subcutaneous tissue, but there is no involvement of axillary lymph node, and on giving the incision there will be evacuation of a chalky white discharge, or you can see a chalky white area after giving the incision over the swelling. Then there will be suspicion of fat necrosis, traumatic fat necrosis. So the key points are trauma, painless lump, hard consistency, and it is attached to skin. So all these points will points toward the fat necrosis. Now we are going to discuss about the fourth one. So on fourth number, a patient present in OPD with previous history of breast abscess, means there is a painful swelling, previously painful, which is treated with antibiotics only. The lump which is painful treated with the medical management, and there is no history of incision and drainage. A patient present with the history of previous breast abscess treated with the medicines only, and there is no history of any IND. And now the patient present with the painless lump which is hard, and it can be fixed to the skin, and which will be soft at the center and hard at the periphery. So a patient with painful lump with medical management now present with the painless lump which is soft at the center and hard at the periphery. So this can be a chronic abscess, or another name antibioma. So this can be the case scenario for the chronic abscess or antibioma. So this is the fourth case. Now we are going to move to the fifth case. Here the lady is middle age, means greater than 40 year, with a huge breast swelling. There can be a huge breast swelling, like if this is a breast, there can be a large swelling like this here, and the veins over the swelling are prominent. You can see the venous engorgement over the swelling, and it is fixed to the skin but free from the chest wall, means you can't pinch the skin over the swelling because the swelling is fixed to the skin, and there is no involvement of axillary lymph node. So this is the point which differentiate it from the malignancy, because in malignancy there is a involvement of axillary lymph node, may or may not the involvement of lymph node, but the swelling is fixed to the skin, huge swelling with venous supply seen on the surface of the swelling. Then it can be a phyllodes tumor, and the phyllodes tumor can be benign or malignant, which can be differentiated on the basis of histopathological examination. So this is the fifth case in list of painless breast lump. Now we are going to discuss about the sixth case. There is a lady with a lump behind the nipple, and the nipple areola complex is destroyed. So this is the key point here. Here is the destruction of the nipple areola complex, and there is a ulcer present over the breast, and in which there is a complaint of itching and vesicles, and the lady attained menopause. So there is a swelling behind the nipple, and there is a destruction of nipple areola complex with vesicles and ulcers over the breast. Then it can be a case of Paget's disease. So this will be a case scenario. Nipple areola complex will be gone in this case. I am going to show you all the pictures of these cases in next slides. Now the seventh case and the last case of painless breast lump in OPD. So there will be a stony hard lump with irregular margins and surface, and there can be a skin changes which includes dimpling, puckering, retraction of nipple, and odd orange appearance. With fixity to skin, muscle or chest wall, there can be involvement of lymph nodes, and there can be mets to bone and liver. So there can be history of back pain, hip pain, and there can be abdominal lump in right hypochondrium. So these are the symptoms: stony hard lump with irregular margins with skin changes and these feature lymph nodes and mets. Then this can be a malignant breast lump which can be confirmed on histopathological examination or FNAC or true cut biopsy. So these are the 7 painless lump with detail and history examination, and on the history and examination finding you can make a diagnosis, probable diagnosis. So after this painless lump, we are now going to discuss about the painful breast lumps. So in painful lump, there is a lady between the 20 to 40 years of age which complain of breast pain associated with menses, and the size of breast lump fluctuates, means increase or decrease with time, and mainly pain before the onset of menses. So this can be a case of fibroadenosis or ANDI, aberration of normal development and involution, and it includes cyst, fibroadenosis, breast adenomas, etc. So there is a lady which complains of breast pain with a lump which fluctuates with time, and the pain mainly during the menses. Then you can think of a diagnosis which is known as fibroadenosis. And after this, so here the pain will be with menses, that's why it's known as cyclical pain. Now we are going to discuss about the non-cyclical pain, and here is the 2 differential diagnoses. First of all, we are going to discuss about this one. There is a lady of 40 to 55 years of age with green or brown nipple discharge. So this is the key point here. There is a discharge of green or brown color from the nipple, and there is a nipple retraction which will be like slit like this, like a slit here, like this. So there is a slit like retraction of the nipple, and there is a lump in the periareolar region around the areola. So this is the case of duct ectasia or periductal mastitis. So the key point for duct ectasia: lump with green or brown discharge with slit like retraction of the nipple. So you will think of duct ectasia or periductal mastitis. And if there is a lady with childbearing age which complain of pain in breast during the lactation, and on examination the breast will be red, swollen, tender on palpation and edematous, and which complain of throbbing pain, and the breast is tender and enlarged, and there will be involvement of axillary lymph node, and there is a history of fever with chills. So basically there is a lactating female with red and swollen painful swelling in the breast with throbbing pain and involvement of the axillary lymph node with fever. Then you will think of breast abscess. So these are the 3 differential diagnoses for the painful breast lump. First is fibroadenosis, then is duct ectasia or periductal mastitis, and then the breast abscess. So this is the all for the painful and the painless breast lump. Now I am going to discuss about the images in breast. So the first one is this. Here you can see a grayish white mass with lobulated surface, and there is a slit-like separation in the mass with firm consistency, and this is known as fibroadenoma. So this is the first. Now the second, here you can see a huge swelling, and you can see the veins over the swelling, bossulated surface. So this is a Phyllos's tumor. And the next one, here you can see the dimpling of skin. You can be asked about the question, why the mechanism behind the dimpling of skin. So you can answer, there is a fibrosis of Cooper's ligament. So this is the ligament which connect the breast with the chest wall here. So in malignancy, there is the fibrosis of this ligament, Cooper's ligament, and it leads to the dimpling of skin. So there will be a dimpling of skin. After this, there is a retraction. You can see the nipple goes inside. So this is the retraction of nipple. And in more detail, circumferential retraction. Two type of retraction will be seen. Slit-like, I have already discussed like this in ductectasia, and circumferential in malignant breast lump. So this is the circumferential. Here you can see there is a destruction of nipple areola complex with vesicles, erythema. So this is the classical case of Paget's disease. After this, you can see there is a erythema of the breast here, tender swelling, painful, lactating female with fever. This is known as breast abscess. After this, there is a differential like this, slit-like. So this is the ductectasia, and here the circumferential retraction. This is for the malignant breast lump. After this, there is a orange-like appearance of the breast, which is known as OD orange. And you will be asked about the mechanism. So there will be blockage of subdermal, below the dermis or skin, subdermal lymphatics by the tumor cells. So there is swelling of breast, which will be seen like the orange, and it is known as OD orange appearance in malignant breast lesions. And after this, you can see there is previous scar of mastectomy, and there is involvement of skin by the tumor cells. So there is the involvement of skin after the surgery by the tumor cells, means there is a recurrence of breast CA, which is known as cancer encurase. So this is the picture of cancer encurase case. After this, what is this? There is a case of mastectomy, and there is the swelling of the ipsilateral limb swelling, upper limb swelling, which will after years, like 10 years, present with the blackening and swelling of skin. This is known case of lymphangiosarcoma. So there is a conversion of lymphedema to lymphangiosarcoma, which is known as Stewart-Travis syndrome. So this is known as Stewart-Travis syndrome, which can be seen after 10 to 15 years after the mastectomy. Now this is the all about the breast lumps, approach to breast lump, and the typical pictures of all the cases. So thank you for this session. I hope this video will help you to become a good clinician.